Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for making time on a very wintry day. I'm probably not in the majority here, but I love snow, so I'm pretty excited to see a little bit of snow, just enough to hopefully not cause trouble on the roads, but to be beautiful. But if you are out moving around, please be safe and be careful. And thanks to our great road crews, county and municipality that are out there, and state as well, keeping our roads safe. So please do be cautious, but enjoy the beautiful winter weather. Diving into a more serious topic, going to give some COVID updates and to also talk about our progress on vaccine distribution. We are still, unfortunately, in and at the peak of the second wave. We were hoping to see the active case count start to go down, and we'll talk about that in a moment here. But the high-level takeaway is that we very much are still seeing high levels of active cases and concerning levels of new infections. So we're still in this second wave, and we still need to do everything we can to get us out of that in terms of those individual and collective actions we've talked about. And we are slowly making progress on vaccines, but not nearly fast enough. So we're really racing against the virus, continue to do that, and continue to do everything we can to move as quickly as we can on that effort. Diving in by the numbers right now, total case count in Ulster County, 9,087 cumulative cases since the beginning of the pandemic, 236,000 plus total tests administered. Fortunately, the vast majority recovering at 6,407. But unfortunately, the tragic human toll of the pandemic in the county continues to grow. And we're not even through the month of January of 2021, and we have had 64 deaths in the county, making this already by far the most deadly month of the pandemic. And if you recall, I said that last month in December, where we had 40 fatalities in the month in the last month of 2020. So it is a very stark and important reminder of the seriousness that we still need to take with the pandemic, and we know the national numbers and the statewide numbers. So we're doing everything we can to blunt those, but clearly we need to push more and really urge each other to go that extra step with the precautions, because until we can get the vaccine numbers up and out faster, our best tools we know to limit the loss of life is the precautions of mask distancing and hand washing. We'll talk more about that in a moment. Hospitalizations are right around the same level, slightly up from our last update last week. We are currently at 35 hospitalized in Ulster County, 5 in the ICU. We're at 33, so we're just slightly up there, but you can continue to see concerningly high hospitalization numbers. Those are not coming down, and so until those numbers come down, we can expect to see more loss of life, unfortunately, and we have to do more to affect that, and we have to do it urgently. The active case count as well, it's pretty stark when you look at this graph. I had said a week or so ago that I was hopeful that we'd start to see us dipping back down, but unfortunately it looks like that dip down was maybe only temporary, and we're now back up to 2,475 active cases at or near the highest levels of the pandemic. So we still very much have widespread transmission of COVID in the county actively, and we need to act appropriately given unfortunately that is still the case. One sign for relative positivity and hope is that the new infection rate over the last week or two, and even in the last 96 hours, is better than it was a few weeks ago. So while we're still seeing high active case counts and hospitalizations and deaths, the new rate is starting to slowly tick down. In the last 96 hours, we were at 6.29%. So we're getting closer and closer and lowering that down, but to be at 6.29% is still much higher than we need to be to get this under control. To give you the raw data behind that, In the last 96 hours, we've tested 5,959 tested, and had 375 new positives in that 96-hour period. So again, 6.29%. Remember back to the summer and the early fall where we were under 1%. That was a much more manageable level. We had very few in the hospital. We had virtually no fatalities. So if we can get that number back down while we're also ramping up vaccine distribution, that's really the best that we can aim for and work for. And it's going to take every one of us to do that, as I've said. Looking at the forward-looking projection, you can see here sort of best, middle, and worst case. I wanted to give a little perspective here in terms of the total. This is cumulative cases since the beginning. And as I said earlier, in Ulster County, we've had 9,087 total cases in the last 10, 11 months of the pandemic, with a population of 180,000 people in the county. And I know, I'm sorry, I'm throwing a lot of numbers. What that really means is 1 in 20 people in Ulster County have had COVID. So think about your extended family and friend network, probably 20 or more people, at least one of those have been affected by this, and that number really continues to grow. And you can see on the projections, if we don't get the rate down, we're approaching 14,000, 15,000, which would put us closer to 1 in 15 or 16. So this has tangible effects on every single one of us, on our families and friends and coworkers, that if we can't get this under control, more and more will be affected, more and more will get very sick, and more will pass away, unfortunately. Looking at our hospital capacity, as I said, we're about the same here, 35 hospitalized currently, 5 in the ICU using ventilators, but we do have sufficient near, medium, and long-term capacity if needed, meaning that it's very unlikely that we'll see any additional restrictions from the state. As a reminder, the governor and the state, I think rightly, have tied any shutdowns or restrictions to concerns about overwhelming our hospitals, and right now we are not at risk of doing that in Ulster County. But again, what we are at risk of is continuing to see the virus spread and perpetuate and affect especially those that are most vulnerable, whether due to age or other underlying conditions. And we just cannot allow us to have another month in February that has the same level of loss and losing people. So we have to act more aggressively. I know it's more difficult in the winter. I know it's more difficult because we've been doing this now for almost a year, but it all goes back to the basics of wearing masks, of washing hands and using hand sanitizer, of maintaining social distancing, and really avoiding gatherings and get-togethers, whether that's just a few people or larger groups. Because once again, if you think about the 1 in 20 number, the bigger group you're interacting with on a regular basis or even a one-time basis, the higher your odds are that you might be affected or that you might actually transmit it unknowingly. So please continue to take this seriously. And just last week, I attended an outdoor memorial service for a 44-year-old gentleman from our county who passed away, showing that this does not, the virus does tend to affect those that are older more heavily, but there are people of all ages, all races, all genders and other factors that are affected by this. And so it's on each of us to be part of getting it back under control. Switching gears a little bit, talking about our work to finally be proactive in that in terms of vaccinations. We do have updated numbers in terms of what's happening this week in Ulster County with vaccine distribution. So this week we have across the county been allocated 1,500 total vaccine doses across the county. That is an increase from last week, so that is good news. It's a slight increase from last week. And I want to talk a little bit about how those are being allocated to make sure that we're fairly and equitably getting these out to those that need them and following the state guidelines for Phase 1A and 1B and senior eligibility that have been articulated by the state. So some more numbers just to help break that down. We've received 1,500 total doses, as I said. Of that, 700 of those doses are prioritized and set aside for seniors. So anyone 65 plus, which we know is about 36,000 people in Ulster County. We have 700 doses that are focused on our seniors, and those will be primarily administered by our local pharmacies. So we are working, our team, side by side with local pharmacy partners to get those out, and I'll talk more about that in a moment and how that is going. 400 of the 1,500 are prioritized for our first responders and teachers and others in Category 1B. Those will be administered by the Ulster County Health Department at our Kingston High School pod site this week. And finally, the last 400 of the 1,500 are focused on continuing to make sure we get all of our healthcare workers who have not been vaccinated, getting them vaccinated. So that's Category 1A. So once again, of the 1,500, you have 400 going to healthcare 1A, 400 going to first responders in 1B, and 700 going to our seniors age 65 plus. We know that that's far short of what we need, but within what we have, we're being very deliberate across the county and the state to make sure that we're fairly dividing that out across those categories. Further building on the importance of equity as we do this, I want to talk a little bit more about what we're doing this week with our senior population, 65 plus in the county. Thanks to a great partnership with one of our local pharmacies, we are doing something new this week. We're actually working through members of our Vaccine Distribution Coalition. We're working with faith and religious leaders and other community organizations. And today across Ulster County, there are 6 different sites at churches and senior residences, both in the Kingston and the Saugerties areas. We had 6 different sites that are still going on right now, where we're administering nearly 300 doses of vaccine. 4 of those were churches in the Kingston area, predominantly focused on making sure those in our communities of color are getting fair and equitable access to the vaccine. So I want to thank our pastors and faith leaders from those churches working that. And then 2 senior facilities in Saugerties, which we've been working closely with our Office for the Aging and with Supervisor Costello and Mayor Murphy and the team in Saugerties. So I want to thank them for their work in that. This is something that we'll continue to do to make sure that as we distribute the vaccine, as we get more, hopefully, going into the future, we'll always have an eye towards ensuring equity, both geographically and demographically and otherwise, so that we're just applying that principle of fairness and equity throughout. I really want to thank the members of our Vaccine Distribution Coalition. This is the group that's been meeting and working regularly to make sure that we have all the right trusted voices in the community making this happen. And I wanted to just share one picture from this morning. It was really a privilege and an honor to get to join Reverend Clark at the New Progressive Baptist Church in downtown Kingston. That's me standing there with Dr. Smaller, one of our pharmacists from Village Apothecary, up in Woodstock. He and his team have been phenomenal. Pastor Clark and his whole congregation were one of those 6 participating, and we had a great turnout there. We've had a great turnout at all of those sites today, despite the weather, and so we'll continue to do that really important work to really have this be a community-driven, grassroots-led effort. And I think it's very powerful for members of a faith community or other community group to hear from their leaders, their trusted leaders, that getting vaccinated is important, that we're prioritizing doing that for you. And I'm really proud of how Ulster County has been doing that already and will continue to do that. The other piece of this, which we've talked about but I want to build on, is making sure that our senior population that we're really going out of our way and doing everything we can, given the technology challenges and the access challenges and the transit and mobility challenges, that we're doing everything we can to get that out to you all quickly and safely and equitably. So once again, our Ulster County Office for the Aging has been doing great work and will continue to assist seniors without internet or computer access. You can call OFA and they will work with you to get you signed up and get your information entered. I know that the technology piece can be a challenge, so we are and want to be here for you. You can call that number, 845-340-3456, 340-3456. The other additional thing that we're doing, given that we know many people have transportation challenges or mobility challenges, I've asked our transit team, our UCAT team that runs the countywide and the citywide here in Kingston bus network, to step up, and a huge thanks to the team there, to Saja and Tony and team. We are now in a position where UCAT will be able to provide no-cost, free rides to anyone in the county who has a vaccine appointment. If you need a ride, we can come door to door and get you to your appointment, wherever that may be. The only thing is you just need to give us 24 hours notice to schedule that. So once you know when you have an appointment, please reach out to us at UCAT. The number is on the screen. I know there are several numbers here. Feel free to share these slides. All this information is also on our COVID-19 webpage. It's also at our Recovery Service Center line. If it's just easier for you to call someone and have a great human being talk you through this, I understand that. And you can call our Recovery Service Center. I know this is complicated and that there's just a lot of anxiety about this, and I understand that. So we're doing everything we can as a county team to be here for everybody, especially for our seniors, and to just try to help each other through this and answer everything we can, do everything we can. All that being said, at the end of the day, we're glad that we're continuing to get vaccines, and we got a little bit more this week, but we still desperately need much more vaccine in the county. We need them now, and I've been saying this, and I'll continue to say this until we get through everybody. We have nearly 70,000 people eligible, and we've still received far less than 10,000 total doses in the county cumulatively. So we have a lot more work to do, even just to get to those that are eligible in 1A and 1B and 65 plus. One slight reason for optimism here, and we'll see how this goes, but just earlier today, the Biden administration did come out and say that they believe that next week they will be able to up the national level of doses. Last week, there were 8.5 million across the country, and the Biden administration is saying they think they might be able to get up to 10 million across the country. Hopeful that will translate to more for us here and more for everybody across the state and the country who are desperate for this life-saving vaccine. So that's some reason for optimism and positivity, and I'm hopeful that we'll continue to see that ramp up, that production will really continue to improve, and that we can solve this supply problem at the federal level that's been holding us back. I'm anxious for that day. In the meantime, we've talked about this, but as a reminder, anyone in Ulster County who wants more information about what's going on with vaccines, we've created a single point of information on our webpage. You just need to go to VACCINATEUlster.com, VACCINATEUlster.com. That has written down all the information that I've just shared in this update and more. It has answers to frequently asked questions. It's got medical information about the vaccine and the risks and the potential side effects. It's got information about eligibility, and there's a place where you can sign up to make sure you're getting regular updates directly from our team and from me about what's happening in the county. So we're sending regular emails and updates as soon as we know what's happening. So lots of information there. That is the goal here, to continue to try to do everything we can to communicate what's happening clearly, both in terms of the public health situation as well as our progress on vaccinations. This continues to be a really, really tough time. I mean, just thinking about the families of those that have lost loved ones just in the last few weeks of the new year, it's really, really hard. It's easy to get down and to feel like we kind of don't know how to get out of this. But when I'm out there, and when I was out there today, I went to 2 of those 6 sites earlier this morning. We are, every single dose and vaccine that we're getting to folks, we are saving lives every single day. The smiles on people's faces, the relief, in some cases the tears of joy and relief as we're administering this vaccine, that does give me great hope and optimism, and we know that that number is only going to continue to grow. So we're not there yet, but there's more good to come as we get through this tough winter and head towards spring, and we will keep working, and I will keep working as hard as we possibly can until we get there. So thank you for tuning in. Thank you to all of our frontline workers who are still putting themselves at risk, and we're doing everything we can to keep you safe and to get more vaccines for you. Final note is that the Recovery Service Center is that single point. If you'd prefer to call rather than going on our website, you can call 845-443-8888. This number is, again, our Recovery Service Center for questions on COVID, on vaccine, but also on needs for food or shelter or mental health, or really any other needs that the county can help with. Please do reach out. Our next update will be 2 days from now, Thursday at 3 p.m. In the meantime, be safe out on the roads if you do have to be out and about. Stay healthy. Let's continue to stick together and be resilient through this, and we'll come out of this winter and head into spring with positivity and health. So until then, take care.